I'm going to speak from the heart, and you know, the slides we'll share with you afterwards.
Always the professional.
It seems that we have some just connection challenges. So basically, I was saying that throughout those 4 summit series, you know, starting in London, the UK, and then Germany, and then Japan, and last year in Jeddah, the idea was to get both the political arm as well as the subject matter experts arm under one roof. And you've seen over the past 4 years actually more and more traction, more momentum to promote and support patient safety throughout. Now, the Jeddah Declaration had 11 items. The first one was to promote patient safety in low and middle income countries. And as we all know that every year, almost 2.6 million people die from adverse events and medical errors in low and middle income countries. And basically this amounts to a huge impact, and even the people that do not end up dying, you know, there are way more numbers of people that are getting harmed, and harm, when we talk about it, is both not just the physical harm but also the psychological harm, and both the physical and the psychological harm end up also resulting in financial harm, both for individuals as healthcare, as patients, but also for healthcare systems. And that results in impact on sustainability of healthcare systems. So I'm going to talk about some highlights of the Jeddah Declaration. And the one which is the promoting patient safety in low and middle income countries, which was the theme of the Global Ministerial Summit on patient safety. Actually, as I sit on the steering committee of the Global Ministerial Summit, we were also very keen on making sure that maybe the 6th summit could be done in a low middle income countries, because we want to also shine the light on the importance of that. So that was one area. One of the other areas was to use the technology and digital health to promote patient safety. So there was the discussion about the establishment of a platform where healthcare professionals, so it's not a healthcare professional to patients, but also healthcare professional to healthcare professional. So it's like a solidarity aspect where we have a platform that could promote that. One other area also in the Jeddah Declaration on Patient Safety talked about building capacity for healthcare professionals and looking after their safety, which is again goes back to the point of the theme of this World Patient Safety Day, which is to highlight the importance of these 2 safeties. We in the Saudi Patient Safety Center we're honored that from day one in the establishment of the center back in 2017, our vision statement stated safer healthcare for all, but all was written in caps letters to highlight the interdependence between the safety of patients and the safety of health workers. One of the activities and initiatives that we worked on was establishment of a white paper that we co-produced with the ICN, the International Council of Nurses, that talks about the nursing ratios and the importance of making sure that for every clinical unit there are predetermined ratios, that if you go beyond, actually both patients and healthcare workers could be impacted. It is an eye-opener to when you go into the literature to find out that healthcare is actually one of the most dangerous industries for workers, sometimes more dangerous than manufacturing industry and mining industries. when you look at the literature. So I'm very optimistic that now with highlighting the interdependence of the safety of patients and the safety of health workers, and not looking at them as a zero sum, but as a complementary to each other, that will give a big boost to the healthcare system's resilience, which is something that is top of mind in the time that we're dealing with COVID. Hopefully that when we look at the lessons learned from this pandemic, one of the main lessons learned is that we need to invest more in patient safety. We need to invest more in healthcare workers' safety. We need them to be joined at the hip. And it's really, you know, the safety of patients and the safety of health workers are two sides of the same coin. Again, apologies for the technical difficulties. I will share with you the presentation, and I'm happy to take any questions if there's any time left. Thank you very much.
Thank you, Dr. Abdullah. Thank you very much. And really, while I was listening to you and thinking of the technical difficulties, I thought that it was really, how can I say, a illustration and vivid illustration of how many hurdles patient safety has. If it is only one technical thing with slides, I can imagine how it looks in the operation theater or along the way from the patient realizing what is happening until the time they are cured and everything in between. I would like to thank you for your message, which really tells us that we are now only starting to unfold the complexity of the patient safety, and that patient commitment, that the political commitment that has been extended for the patient safety is so valuable. And we really, really appreciate Dr. Jeremy Hunt's and yours personal involvement into this process. As the time is approaching for the next session, I would like to invite everyone to submit their questions so that Dr. Abdullah can respond to them in a written or in a different way. And we would be really would like to invite you to have a separate webinar so that we can discuss in more details all the elements of the patient safety that you have described to us and all the multisectorality that is needed. Thank you very much.
Thank you very much, and I look forward to future collaboration and activities together with your organization.
Thank you very much, Abdullah, and I think we'll meet again in Switzerland hopefully soon, and have a great time out there. And we'll send the questions over to you. And now I think your friends, Professor Dame Sally Davis is going to start the session on AMR, and Thomas Queenie. So I will request the audience to please leave this room and go back to the auditorium and join the next session. It's a great session to look at the AMR Action Fund and the next pandemic that's going to come. If we don't deal with it, we have got grave problems. Thank you very much, everybody, and let's rejoin and I'll see you on the other side. Thank you.